Good afternoon, and thank you for joining us for today's webinar, The Affordable Care Act and Insurance Marketplace, What Every PKD Patient Needs to Know. I am Nicole Haar, Education Manager at the PKD Foundation, and I will be your host throughout this presentation. We are very excited to be able to bring you information about how the Affordable Care Act affects PKD patients and families and up-to-the-minute information on navigating through the insurance marketplace to you today. We will begin the presentation in just a moment, but first I have a few announcements to assist you in participating in today's broadcast. We encourage you to type any questions you may have into the question box on the right side of your screen at any time during the webinar, and we will save time at the end of the presentation to answer as many questions as possible. Please note that the PKD Foundation does not offer medical advice, and the information shared today is not intended to be a substitute for consultations with your health professionals. We strongly recommend that care and treatment decisions related to your health concerns be made in consultation with your health professional team. We are recording this webinar, and we will archive the recording on our website within the next few days. To get us started today, I would like to introduce the PKD Foundation CEO, Jackie Hancock.
Thanks, Nicole. I'm Jackie Hancock. I'm the brand new Chief Executive Officer for the PKD Foundation. And I'd like to welcome you to our last webinar of the year, and probably our most timely webinar. I think the Affordable Care Act has obviously had a lot of press, a lot of information out there, and there's also a lot of misinformation about the ACA. So today's webinar, I hope, will give you the information that you need to kind of go forward. On behalf of all of our staff and our Board of Trustees, I'd also like to wish everyone happy holidays, and hope that you stay warm and have a great and safe, happy holiday season. I'd also like to introduce George Sifakis, who is the CEO of Axela, located in Washington, D.C. George has been a good friend and advisor to the PKD Foundation over the years, and has actually helped us to arrange to get someone from the CMS to present today and get it sort of straight from the horse's mouth. So George, I'm going to give it over to you and let you introduce our speaker for today.
Jackie and Nicole, thank you so much. This is George Sifakis. I serve as the Washington Office Director for the Foundation. It's an honor and a privilege, as always, to assist in helping to tell the PKD story, and in this case, to address issues related to the Affordable Care Act. With us today is a gentleman from CMS, Jermaine Burkhalter. He is a health insurance specialist at the Centers for Medicare and Medicaid Services. Jermaine coordinates the agency's information management system, and he works with various medical providers on health insurance marketplace outreach and education. Before joining CMS, Jermaine was a grant specialist at the Administration for Children and Families, where he also coordinated an information management system and led program evaluation and capacity building efforts. Jermaine, welcome. We are very much looking forward to hearing from you today, especially in light of the implementation of the Affordable Care Act and all of the questions that surround the exciting facets of the Affordable Care Act. And so with that, welcome and thank you.
Thank you so much, George, for that great introduction. Once again, my name is Jermaine, and I'm a specialist here in the CMS Office of Communications, and I'm really excited to have this opportunity to speak to you all today about the health insurance marketplace. Before I get started, I just wanted to apologize in advance. There might be some background noise during my presentation. I'm in an office with an open floor plan, so if there is some noise, I really apologize for that. This is a broad marketplace one-on-one presentation that provides a high-level overview of the Affordable Care Act, which I'll often abbreviate as the ACA during my presentation, and it'll particularly focus on the new health insurance marketplace. CMS developed and approved this training module, and it's updated as of October. And you can find this training module at marketplace.cms.gov. To check for updates on the healthcare legislation, you can visit hhs.gov/healthcare. This presentation isn't a legal document. Official program provisions are contained in the relevant statutes, regulations, and rulings. And as you can imagine with federal government presentations, particularly with something as consequential as the ACA, there is some script here just to ensure that we're being as legally precise as possible. However, I'll try to summarize things as much as possible. Okay, Congress passed and the President signed the Affordable Care Act in March 2010. Some key provisions that have already gone into effect are young adults who can get coverage through their jobs can stay on their parents' plans until age 26. Also, the 50 million Americans with Medicare have access to new benefits like free preventative care, savings on prescription drugs, and when they hit the coverage gap, known as the donut hole. About 71 million people with private insurance can also get recommended preventative care without paying any copay or deductible. The law also removed lifetime limits. The ACA has additional improvements to health care that start in January 1st, and we'll talk more about those. Some of the improvements brought about by the Affordable Care Act are effective as of January 1st include the following: discrimination due to pre-existing conditions or gender is prohibited. Annual limits on insurance coverage are eliminated. Advanced premium tax credits are available. The small business tax credit will increase. More people will be eligible for Medicaid in some states. The open enrollment period for consumers to start selecting health plans began October 1st, with actual coverage beginning as early as January 1st. So that's the slide that I just went through. So what is the health insurance marketplace? The marketplace is sometimes referred to as exchanges or Obamacare. The word exchange is just a synonym for the marketplace in this instance. And exchange was actually in the legislation, but we've renamed it to marketplace because marketplace is a more literal descriptor of what we're talking about here. Is essentially it's a marketplace of healthcare plans. Obamacare is a synonym for the ACA, which is much broader than just the marketplace. The health insurance marketplace is designed to help you find health insurance that fits your budget. Every health insurance plan in the marketplace offers comprehensive coverage, from doctors to medications to hospital visits. You can compare all your insurance options based on price, benefits, quality, and other features that may be important to you in plain language that makes sense. You'll know you're getting a quality health plan at a reasonable price because there's nothing buried in fine print. It's in clear language. There's a marketplace for small business too as well, and we'll talk a bit about that. It's called the Small Business Health Options Program, or SHOP. And as I said, we'll talk a bit about SHOP later, but this presentation really focuses on the individual marketplace. So overall, because of the ACA, about 90% of people who currently don't have insurance will qualify to get a break on their costs. This includes coverage by Medicaid, the Children's Health Insurance Program, or CHIP, and cost savings in the marketplace. Thanks to new rules and expanded programs, even working families are able to get through the health insurance marketplace. There are new expanded programs available, and more people than ever before qualify for free and low-cost health insurance programs. And even if you think your income is too high to get help, you should apply anyway. And a streamlined application makes it easy for you to do that. So states had three options. They could run their own marketplace, they could partner with the federal government to run some marketplace functions, or their residents fall within the federal marketplace that's run by the federal government. A state may apply at any time to run its own marketplace in future years, and that's something important to remember. The state can always start up their own marketplace in the future if they choose to. A partnership marketplace allows states to make recommendations for key decisions and help tailor marketplace to meet local needs and market conditions. States may choose to run a small business health options program marketplace as well. The ACA provides for the establishment of what's called essential health benefits that all health plans in the marketplace must cover. The law directs the essential health benefits to be equal in scope to the benefits covered by a typical employer plan and cover at least the following 10 general categories. And they are ambulatory patient services, and that includes outpatient care you get without being admitted to a hospital, emergency services, hospitalization such as surgery, maternity and newborn care, care before and after your baby's born, mental health and substance use disorder services including behavioral health treatment. This includes counseling and psychotherapy. There's prescription drugs, rehabilitative and habilitative services and devices, that's services and devices to help people with injuries, disabilities, or chronic conditions, gain or recover mental and physical skills, laboratory services, preventative and wellness service and chronic disease management, pediatric services including oral and vision care, that's pediatric oral services, may be provided by standalone plan as well. And it's important to know that there may be optional standalone dental plans in your marketplace for adults. However, you can't get a standalone dental plan without first being enrolled in a qualified health plan in the marketplace that covers a broad range of benefits. Okay, qualified health plans in the marketplace can vary. For instance, some plans may cover additional benefits. You may have to see certain providers or use certain hospitals. Premiums, copays, coinsurance are different in different plans. The quality of care can vary, but quality data are available. The coverage level can vary within each plan, and you'll see more information on that in the next slide. Some plans are structured differently, like high-level deductible catastrophic plans, and we'll talk more about that. Remember, all plans must cover the essential health benefits. The marketplace lets you compare, choose, and enroll. Out-of-pocket costs include deductibles, which is the amount you pay for your covered health care services before your plan starts to pay. You also pay copayments. And for instance, you may have to pay $20 each time you see a doctor. You may also have to pay coinsurance for certain services. For instance, if the coinsurance is 30% and the covered service costs $100, you would pay $30 and the plan would pay $70. Okay, the plan levels of coverage. The actuary value, or AV, in the aggregate for a standard population can be considered a general summary measure of health plan generosity. For example, if a plan has an AV of 70% on average, you would be responsible for 30% of the cost. You would be responsible for 30% of the cost on all covered benefits, covered services for the year, depending on the actual healthcare needs and the terms of your insurance policy. So while premiums are not taken into account to calculate the AV, generally plans with a higher AV and more generous cost sharing tend to have higher premiums. The important takeaway is that the AV is a measure that the federal government uses in determining health plan generosity, and the higher the AV, generally the more the plan covers. Okay, the ACA requires that plans must meet certain levels of coverage, and each of these levels of coverage is associated with an actuary value, which is in section 1302D of the statute. And it requires it be calculated based on the provision of the essential health benefits to a standard population. Right, there are 4 levels of coverage, and they are as follows. There's a bronze level, and it's a health plan that has about an AV of 60%. There's a silver level plan, has about an AV of 70%. This is the second lowest cost silver plan, and the rating area is used for figuring the reductions in cost sharing and the premium tax credit for individuals, which we'll talk more about. There's a gold level, which are plans that have an AV of 80%, and then there's a platinum level, which is the highest level of a plan, which has an AV of about 90%. So, of course, the platinum plan with an AV of 90% tends to cover much more than the bronze plan with an AV of 60%. slide here. So catastrophic plans. A catastrophic plan generally requires you to pay all your medical costs up to a certain amount, usually several $1,000s. Costs for essential health benefits over that amount are generally paid by the insurance company. They generally have lower premiums, protect against high out-of-pocket costs, and cover 3 annual primary care visits and preventative services at no cost. They are available only to people under 30 and to people who have received certain hardship exemptions. Each member of the family must meet eligibility requirements to purchase. People with catastrophic plans are not eligible for the premium tax credits to lower their monthly premiums, and we'll talk more about the tax credits in a minute. You may qualify for a hardship exemption if certain circumstances affect your ability to purchase health insurance coverage. Hardship circumstances include, but are not limited to, being homeless, being evicted in the past 6 months, or we're facing eviction or foreclosure, having received a shut-off notice from a utility company, recently experienced domestic violence, recently experienced the death of a close family member, experienced a fire, flood, or other natural or human-caused disaster that caused substantial damage to your property, you filed bankruptcy in the last 6 months, or had a medical expense that you couldn't pay in the last 24 months. Okay, so one slide on SHOP. So small businesses have access to a streamlined way to offer health insurance to their employees for 2014 and future years. It's called the Small Business Health Options Program, or SHOP Marketplace. The SHOP Marketplace is open to employees with 50 or fewer employees in 2014, and in 2016 the program will be open to businesses with 100 or fewer employees in all states. And a few states could choose to expand this eligibility to such businesses before then. The SHOP Marketplace is part of the health insurance marketplace, and it gives small businesses and their employees access to qualified health plans that must include a package of essential health benefits, like coverage for doctors, visits, preventative care, hospitalization, prescriptions, like we talked about a few slides ago. Small businesses, including nonprofit and religious organizations, can participate in the SHOP Marketplace. And for those who complete the enrollment process by the deadline, coverage will take effect as early as January 1st. Small businesses will also be able to enroll and offer coverage to their employees anytime after January 1st of next year. There is no requirement for the ACA for small businesses with fewer than 50 employees to offer health insurance, nor is there any fee for those small businesses who do not offer health insurance. Instead, the law offers small employers a range of new options, tools, and protections, and for many tax credits to help those who would like to or already offer employer health coverage. And for specific questions on SHOP, you can call the call center, and that number is 1-800-706-7893. That's 1-800-706-7893. And there's also more information about the SHOP Marketplace on our site at marketplace.cms.gov. There's training materials and articles, a lot of additional resources on SHOP. Okay, so let's get back to the individual marketplace again, and let's talk about eligibility. To be eligible to enroll in a marketplace, you must live in its service area. You must also be a U.S. citizen or a national, or be a non-citizen who is lawfully present in the U.S. for the entire period for which enrollment is sought. You also cannot be incarcerated unless you are pending this, deposition of charges. However, those who are incarcerated can apply for Medicaid or CHIP at any time. Okay, when you use the marketplace, you may be able to get lower costs on your monthly premiums and out-of-pocket costs. The premium tax credit is generally available to individuals and families with incomes between 100% and 400% of the federal poverty level, and that is $23,550 to $94,200 for a family of 4 in 2013, this year. All right. So the premium tax credit is generally available to individuals and families who do not have access to certain other types of minimum essential coverage, which makes coverage much more affordable for the middle class. And remember, minimum essential coverage includes government-sponsored coverage like Medicare, Medicaid CHIP, some VA coverage, TRICARE, affordable employer-sponsored insurance, meaning the cost for the employed individual is no more than 9.5% of their income, and certain other coverage. The advanced premium tax credit available through the marketplace lets you reduce your premiums right away or wait to receive the premium tax credit until tax time. There are special rules in case of divorce. If you get married, the savings amount is computed by month. The Congressional Budget Office estimates that when the Affordable Care Act is phased in fully, the premium tax credit will help 20 million Americans afford health insurance. So in summary, the premium tax credit is claimed after the tax year as a refund. The advanced premium tax credit is claimed during the tax year, and it's paid directly to your health insurance provider to lower your costs during the year. Both of these tax credits are intended for families who are just above the income level that qualifies for subsidized health care. Okay, so this chart illustrates the 3 ways you can choose to take your premium tax credit. If you use it all, you can lower your premium the most. You would most likely not get money back as a credit on your federal tax return. If your circumstances like income or family size change and you don't notify the marketplace, you may likely have to pay money back when you file your taxes. If you use part of the premium tax credit you qualify for, your premium may be lower, and you may get some money back as a credit on your federal tax return. If your circumstances like income or family size change and you don't notify the marketplace, you may have to pay money back when you file your taxes. And finally, if you choose not to use any of your premium tax credit to lower your premiums, you would pay the full premium each month. However, you would get money back as a credit on your federal tax return. You would not have to pay money back, however, should you still notify the marketplace of any changes. It's important to remember to report to the marketplace any changes in financial circumstances or family size immediately, including changes in household income, marriage, divorce, birth or adoption of a child, other changes to household composition, or gaining or losing eligibility for government or employer-sponsored health coverage. And you can check the information on your application, or you may not get the right amount of savings. If you earn more income than the qualifying household income amount, the amount of savings for which you are eligible is lower when you file your tax return. In this case, you might owe money at the end of the year. If you make less than you expected, you may be eligible to receive a refund based on a higher premium tax credit at the end of the year. You would do this on your next tax return. If you think a mistake was made when you get your savings decision determination in the marketplace, you have the right to appeal. The marketplace eligibility determination will explain how to do this, and for more information on appealing a tax credit decision, you can visit healthcare.gov. Okay, who is eligible for a cost sharing deduction? So we just talked about tax credits. So another way to lower costs for families who qualify is a cost sharing reduction. So cost sharing reductions are available to help reduce out-of-pocket expenses. To be eligible for cost sharing deductions, you must have a household income that is less than or equal to 250% of the federal poverty level, which is $58,875 annually for a family of 4 in 2013. You must also meet the requirements to enroll in a health plan through the marketplace and receive the new tax credit, and enroll in a silver level plan through the marketplace. So to be eligible for the cost sharing deduction, you have to qualify for the new tax credit, and you must be enrolled in a silver level plan. Members of a federally recognized Indian tribe may also be eligible for special cost sharing reductions. Certain American Indians and Alaska Natives who purchase health insurance through the marketplace do not have to pay co-pays or other cost sharing if their income is under 300% of the federal poverty level, which is roughly $70,650 for a family of 4 in 2013. And it's a bit higher in Alaska, $88,320. So let's briefly talk about Medicaid eligibility in 2014. Another important part of the ACA is Medicaid expansion. And beginning January of next year, individuals under 65 with incomes up to 133% of the federal poverty level are eligible for Medicaid in those states that implement Medicaid expansion. And remember that states, just like the marketplace, had the option to expand Medicaid or not. In addition, all children with incomes up to 133% of the federal poverty level are eligible for Medicaid. Those states that previously covered these children through the CHIP program will continue to receive the enhanced CHIP matching rate. And in addition, the rules for counting income for purposes of determining Medicaid and CHIP eligibility is much simpler and easier for families to understand. When you apply for Medicaid through the marketplace, the information you provide is data matched against the information the IRS and the SSA have in their systems. And when submitting your information, you will have 3 attempts to verify information. If the data doesn't match, you have to provide proper paper documentation to complete your application. In states that don't implement Medicaid expansion, people between the state's Medicaid ceiling, and it varies by the state, and 100% of the federal poverty level are not eligible for Medicaid or the new tax credit. However, these individuals are not subject to the fee if they do not obtain coverage through the marketplace. And people with income above 100% of the federal poverty level are eligible for the tax credit. And we'll talk more about the fee in a minute. Starting next year, everyone must either have minimum essential coverage, have a coverage exemption, or pay fee. And it's called the fee. It's called the shared responsibility payment. If you have minimum essential coverage, you don't have to do anything. You're fine. You are already covered, and you're fine. If you qualify for an exemption, you won't have to pay the fee even if you don't have coverage. But if you don't have coverage and you don't qualify for an exemption, you have to pay a fee. And we'll look at what that means. Okay, so let's talk about minimum essential coverage. Minimum essential coverage is coverage that meets a standard that provides essential health benefits that we talked about earlier. If you have any of these types of coverage, you have minimum essential coverage, and you don't have to do anything. And about 85% of Americans have minimum essential coverage. So minimum essential coverage, that is employer-sponsored health plans that includes COBRA and retiree coverage. It includes Medicare, Medicaid, CHIP, the marketplace coverage, the health plans you buy via the marketplace, individual coverage that you get like outside the marketplace, TRICARE, or certain types of VA coverage. All those different types are considered minimum essential coverage. The following are also considered minimum essential coverage, and that's coverage provided to Peace Corps volunteers, coverage under the non-appropriated fund health benefit program, a refugee medical assistance supported by the Administration for Children and Families, self-funded health coverage offered to students by universities for plan or policy years that began on or before December 31st, 2014. Right. Minimum essential coverage does not include coverage providing only limited benefits, such as coverage only for vision care or dental care, and Medicaid covering only certain benefits such as family planning, workers' compensation, or disability policies. Okay, if you don't have minimum essential coverage, you may have to pay a fee, and this is sort of the individual mandate right? So if you don't have health insurance, you have to get it. And, you know, there are a lot of ways to do that. And I talked about the Medicaid expansion and also, you know, buying a plan via the marketplace. So you have, so the ACA mandates that individuals purchase insurance. So let's talk about the fee. You may get an exemption from the fee for one of these reasons: religious conscience, membership in a recognized health care sharing ministry, membership in a federally recognized Indian tribe. You have no tax filing requirement. If you have a short coverage gap, it's less than 3 consecutive months. You suffered a hardship, and that's a circumstance that affects your ability to purchase health insurance coverage, like being homeless or recently experiencing domestic violence. We talked about those exemptions earlier. You have an unaffordable coverage. You have only unaffordable coverage options. You are incarcerated, or if you are not lawfully present in the U.S., neither as a U.S. citizen or U.S. national. Okay. To apply for an exemption based on coverage being unaffordable, membership in a healthcare sharing ministry, membership in a federally recognized tribe, or being incarcerated, you have 2 options. You can claim these exemptions when you file your 2014 tax return, which is due in April of 2015, or you can apply for the exemptions in the health insurance marketplace. To apply for an exemption based on membership in a recognized religious sect whose members object to insurance, eligibility for services through an Indian healthcare provider, or one of the hardships that I described, you can fill out an exemption application in the marketplace. If your income is low enough that you're not required to file taxes, you don't need to apply for an exemption. This is true even if you file a tax return in order to get a refund of money withheld from your paycheck. You won't have to make the shared responsibility payment. And for more information, you can visit the IRS site, and that's www.irs.gov/pub/IRS-PDF. Right? If you have a gap in coverage of less than 3 months, or you're not lawfully present in the U.S., you don't need to apply for an exemption. This will be handled when you file your taxes. If you have 2 short gaps in coverage during a year, this exemption only applies to the first gap. When an uninsured person requires urgent, often expensive medical care but don't pay the bill, everyone else ends up paying, right? So, you know, if someone doesn't have insurance and they have to go to the emergency room, we all end up paying for that. And that's why the ACA requires all people who can't afford it to take responsibility for their own health insurance by getting coverage or paying a fee. People who choose not to obtain health coverage will also have to pay the entire cost of all their medical care. They won't be protected from the kind of very high medical bills that sometimes lead to bankruptcy. So the fee in 2014 is $95 per adult and $47.50 per child, and the total amount is $285 for family, or 1% the yearly income, whichever is greater. The fee cannot be more than the national average price for a bronze level plan in the marketplace, and the amounts of the fees go up after 2014. It's important to remember that someone who pays the fee won't get any health insurance coverage. So it's a sunk cost, right? You're paying a fee without getting anything, so you might as well pay the fee to have health insurance coverage. After open enrollment ends, March 31st of next year, people won't be eligible to get health insurance coverage through the individual marketplace until the next enrollment period, which is October 15th through December 7th of each year. This is true unless they have a qualifying life event that provides for a special enrollment period. According to the Congressional Budget Office, less than 2% of Americans are expected to choose to go without coverage and will owe a shared responsibility payment. Right, after the open enrollment period ends of March 31st of next year, people won't be able to get health insurance coverage, as I mentioned. When you pay the fee, you pay the fee when you file your 2014 federal income tax return in 2015, and thereafter, the IRS routinely works with taxpayers who owe amounts they cannot afford to pay. And it's important to note that the law prohibits the IRS from using liens or levies to collect any payment you owe related to the individual responsibility provision if you, your spouse, or your dependent included on your tax return does not have minimum essential coverage. Okay. So the marketplace may only permit a qualified individual to enroll in a qualified health plan or an enrollee to change qualified health plans during the initial open enrollment period, again, which is October 1st of this year through March 31st of next year, right? Which is the open enrollment period, or a special enrollment period for which the qualified individual has been determined eligible. And that's such as, a qualified individual or dependent loses minimum essential coverage, gains a dependent, or becomes a dependent through marriage, birth, adoption, or placement for adoption, or an individual who was not previously a citizen, national, or lawfully present individual gains of status. So for this 2015 benefit period and beyond, the open enrollment period begins October 15th, as I mentioned, and extends through December 1st of the preceding calendar year. And for example, October 15, 2014, qualified individuals can begin enrolling in coverage that will start January 1st. So for this current enrollment period, consumers have until December 23rd to enroll in plans that will start January 1st. Okay, and for proceeding for following enrollment periods, they will have until December 7th to enroll in plans that begin at the beginning of the next year. The marketplace may automatically enroll qualified individuals at such time in such manner as HHS may specify, and subject to the marketplace demonstrating that HHS that it has good cause to perform such automatic enrollments. And starting in 2014, the marketplace must provide a written annual open enrollment notification to each enrollee no earlier than September 1st and no later than September 30th. And it's important to note that you can apply for Medicaid and for CHIP at any time. And those two are state specific. They're run by the states. So how the marketplace works. There are 4 steps to using the marketplace. The first step is to create an account. So first provide some basic information, then choose a username, a password, security questions for added protection. The second step is apply. You'll enter information about you, your family, including your income, household size, other coverage you're eligible for, and more. And you can visit healthcare.gov to get a checklist to help you gather the information you'll need. The third step is to pick a plan. You'll see the plans and programs you're eligible for and compare them side by side. You'll also find out if you can get lower costs on monthly premiums and out-of-pocket costs. The fourth step is to actually enroll. You'll choose a plan that meets your needs, and you'll enroll, and the coverage starts as soon as January 1st of next year. You can apply for coverage in the marketplace by phone, online, in person, or by mail. The number for the National Health Insurance Marketplace Call Center is 1-800-318-2596. That's 1-800-318-2596. The customer service representatives are available 24 hours a day, 7 days a week, including New Year's Day. The call center is closed on certain holidays. That includes Thanksgiving, Christmas, Labor Day, Memorial Day, and the 4th of July. The call center provides objective information in English and in Spanish. It uses language lines for 150 additional languages. The customer service representatives help customers go through the eligibility and enrollment process and refer them to a local in-person help if needed. When you call, you are asked what state you live in, which is very important. If you live in a state operating a state-based marketplace, you are provided with the number to that state's marketplace call center. Healthcare.gov can help you identify your options for health insurance. The website is also available in Spanish at Cuidad de Salud.gov, so that's CUIDADODESALUD.gov. This website is also accessible for those with visual disabilities. If your state is running its own marketplace, you will be referred to its website, as I mentioned, as well with the Spanish, with the English website as well. If you click on Preview Plans and Prices on healthcare.gov, you can see what plans that are available in your area and their full cost. If you qualify for a tax credit or cost sharing reduction, you would save on these costs. So healthcare.gov, tells you all that. When you enter in your information, it'll tell you what types of plans are in your area, whether you qualify for help, essentially, so for the tax credits or for the cost sharing reductions. The in-person help is also available, and you can find trained and certified help to apply and enroll by visiting localhelp.healthcare.gov. That's localhelp.healthcare.gov, or call the Marketplace call center and they can direct you to in-person help in your area. There's also a paper application that is available for download and printing on healthcare.gov. All right, so let's talk a bit more about in-person assistance. There are several programs to help you through the process of enrolling and using health insurance, including the Navigator program, non-Navigator assistance personnel, agents and brokers, and certified application counselors, who also play a large role in helping people apply for health insurance coverage. It's important to note that some of the assistance resources, marketplace call centers and websites and navigators, are required to provide unbiased and impartial advice, while others, such as agents and brokers and user websites and call centers, are not. Organizations that don't meet the requirement to become certified assisters are invited to become a champion for coverage, and they can help educate the public about the marketplace and refer them to resources where they can find assistance. So we have certified application counselors, and these are in-person assisters. So many organizations choose to help with enrollment in this way, in this sort of hands-on way. But we also have what we're calling champions for coverage, and this is organizations who want to partner with us to educate the public on the marketplace and how to enroll, but they don't actually help consumers directly enroll. Okay, so a word about Medicare. Medicare is not part of the health insurance marketplace. It provides minimum essential coverage. If you have Medicare, you don't have to do anything. The marketplace doesn't change your Medicare plan choices or your benefits. Medicare plans and supplement Medigap policies are not available in the marketplace. The marketplace annual open enrollment period is from December 15th through December 7th of each year. If you turn 65 in 2014, you can get a marketplace plan to cover you before Medicare begins. Your Medicare coverage begins. You can then coordinate canceling your marketplace plan when your Medicare coverage starts to avoid a gap in coverage. If you enroll in Medicare after your initial enrollment period ends, you may have to pay a late enrollment penalty for as long as you have Medicare. When you leave a job, you may be able to keep your job-based health coverage for a period, usually up to 18 months. This is called COBRA, continuing coverage. You can drop COBRA coverage during the marketplace open enrollment period and get a marketplace plan. It's important not to let your COBRA coverage end before your marketplace coverage begins in order to avoid that gap in coverage. If your COBRA expires, you can get a special enrollment period and you can enroll in a marketplace plan within 60 days. The ACA established the pre-existing condition insurance plan, otherwise known as PCIP program, in every state in the District of Columbia. There are about 110,000 people currently in PCIP plans nationwide. The PCIP provides temporary coverage to people with pre-existing conditions. This program ends on December 31st of this year. If you are enrolled in a PCIP plan and you want to ensure that no breaking coverage, there's no breaking coverage, you need to enroll in a plan in the marketplace, and you must do that by the deadline, which is December 23rd. The PCIPs will send notices to their enrollees to make them aware and encourage them to take action. Notices are to be sent in late October and early November. Enrollment in the marketplace began on October 1st. So some PCIP enrollees may be eligible for Medicaid or other sources of coverage. And again, going to healthcare.gov, entering in their information, it will tell them what they qualify for. If they qualify for Medicaid in their state, it will tell them that. So here are some key points to remember. The marketplace is a new way to find and buy health insurance. Individuals and small businesses can shop for health insurance that fits their budget. States have flexibility to establish their own marketplace. Individuals and families may be eligible for lower costs on their monthly premiums and out-of-pocket costs. And there is assistance available to help you get the best coverage for your needs. So you can get up-to-date information to help you counsel people who may benefit from the health insurance marketplace at marketplace.cms.gov. So on this site, we have a lot of training resources for organizations to train consumers on what they need to do. So we have a range of resources there. And on marketplace.cms.gov, we also have information on how organizations can apply to become certified application counselors and champions for coverage as well. If you need more information about the health insurance marketplace, you can sign up to get email and text alerts at healthcare.gov/subscribe. Updates and resources for partner organizations are available again at marketplace.cms.gov. Right, so that is the last slide. That's the end of the presentation, and we are ready to open it up to questions.
Thank you, Jermaine, for providing all that information. We really appreciate it. Let's go to our first question. After a kidney transplant, once Medicare coverage ends, can I purchase insurance through the insurance marketplace that will cover my immunosuppressive medications?
Yes, you can. You would just go to Marketplace and you would select the best plan that meets your needs on Marketplace on healthcare.gov.
Okay, thank you. If I purchase insurance through the marketplace, will my medications, including immunosuppressive drugs, go towards the deductible and or out-of-pocket expenses?
Okay. Sorry, can you repeat that question for me?
Yes, so this is from someone that has had a kidney transplant. If they purchase insurance through the marketplace, will medications, including immunosuppressive drugs, go towards the deductible or any out-of-pocket expenses?
So where medications go through out-of-pocket expenses?
Yes.
Yeah, so I'm just looking for some information that will answer that question. Just a second. Can we go to the next one and come back to that one?
Sure. If I purchase insurance through the insurance marketplace, do I still need to apply for Medicare when I am ready for dialysis or for a kidney transplant?
Just a second. Can you give me a minute, Nicole? Sorry. I'm having trouble with my computer. Just a second.
Sure. Thank you. And to all of our attendees out there, I know we still have about 10 minutes, so we'll get to as many questions as we possibly can, but if you still have questions, feel free to type them in, and as we get these answered, we will move to the next one and get through as many as we can during our last few minutes. And Jermaine, if you want to just provide me answers to those questions, if it'd be easier, we can move on to the next one, and we can post these on our website, or you know, resources where the answers might be found on our website as well.
Okay. Yeah, yeah, I think we should do that.
Okay.
Sorry.
Okay. So if a family qualifies for financial assistance for premiums, do they pay the full premium up front and get it back on their taxes, or do they pay their portion of the premium monthly?
So they could choose either one. So they could choose either one of those options.
Okay.
They could pay the full premium and then get a refund when they pay their tax return, or they could choose the advanced premium tax credit, and that will pay a portion of the premiums.
Okay.
Throughout the year.
Okay. Next question. I have a patient who is a foreign national and whose visa is expired. She has applied for a green card, and ICE has told her she doesn't have to leave the country. Does she qualify for the marketplace?
I'm sorry, can you repeat that? I'm having trouble hearing you.
Sure. I have a patient who is a foreign national and whose visa is expired. She has applied for a green card, and ICE has told her she doesn't have to leave the country. Does she qualify for the marketplace? So does she qualify to buy an, okay.
Yes, she does.
Okay.
Yes, she does.
All right. Next question. For domestic partners, can they be on a family policy? So I have a friend who has a child with her partner, and the dad and the child can be on a policy, but she cannot. She was referred to Medicaid, but she is in a state that isn't expanding.
Why don't I follow up about that? I mean, it depends on the state. It's a bit tricky with Medicaid because it's state specific, and so it depends on what specific state they're in.
Okay. So we can follow up on that one then. Thank you. When purchasing through the marketplace, will most carriers be available?
Yes, they will. It depends on the area. It depends on the area that they're in. But, you know, health insurance companies, providers, they really have an incentive to be on the marketplace, right? Because they want that business. This is a great opportunity for them to really expand the customers that they have. So definitely the large insurance providers tend to be in the marketplace, but it's really going to depend on the state and the particular location that you're in that's going to determine what types of plans and what providers are available for you.
Okay. I have another question here. Does my nephrologist that I use now have to accept the insurance plan that I choose when I purchase on the marketplace?
So no, it's going to depend on what particular plan that you choose and what particular sort of doctors are available for use with that particular plan. So it's just going to depend on your specific plan that you choose.
Okay. Next question. I currently cannot afford insurance due to unemployment. So am I eligible to apply for Medicaid?
I'm sorry, can you repeat that again for me?
Yes. I currently cannot afford to purchase insurance due to unemployment. Do I qualify for Medicaid?
Well, it depends on it depends on your state, the state that you live in, and it also depends on how long you've been employed, how much money you've made this year. So it's going to depend on a few things, but what I suggest is that you go to healthcare.gov, you create an account, you put in any income information that it asks for, and you put in, it's going to ask for your state, you put in that, and it's going to tell you if you qualify. So, again, the great thing about healthcare.gov, it's sort of like a one-stop shop. So it's a great place to go to. It's the place to go to find out what you qualify for in your particular state. So if you qualify for the tax credit, cost sharing reductions, or like a Medicaid in your particular state, it's going to tell you that. So that's the place to go to. And I'm sure that a lot of you heard about the problems that we had with the site initially, but I'm happy to say that the response times are much quicker now. Most of the problems have been corrected, so it's much sort of easier to use now. So I really encourage you to go there.
Okay, thank you. Next question, if I am covered by my husband's work insurance, do I need to apply for additional coverage through the marketplace? Will having PKD affect my company coverage in 2014?
So if you're covered by your husband's employer-based plan, you're fine. You're fine, right? So existing employer-based plans is a minimum essential coverage, so that's fine. So if you're covered by that, you don't have to do anything. You're okay.
Okay. Let's see here. Okay, here's the question. We currently have Medicare and a secondary insurance through Blue Cross. Should we keep those or change? Which coverage is better?
It really depends, right? I mean, I encourage you to explore the options in your area. So if you have, I think it was Medicaid or Medicare.
Medicare.
Medicare. So if you have Medicare, you're probably you're fine because Medicare is subsidized coverage, so you're fine generally. But you could, if you wanted to, you could explore what plans are available in your area to see if the plans in your area offer some more coverage, that you might benefit from. But I will say that if you have Medicare now, a lot of your health benefits are being subsidized. So you'll likely, if you choose to get a plan on the marketplace, you're probably going to have to pay more than you're currently paying. So it's a trade-off that you have to weigh if you want coverage for sort of more benefits, and if you're willing to pay more, that might be an option. But I would encourage you, again, to go to healthcare.gov to see what plans are available in your area.
Okay. Okay. If a person that has PKD is visiting the United States from overseas, but happened to visit hospital because of the disease, can he or she qualify for the insurance marketplace?
And they're not U.S. citizens?
Well,
so if they're visiting from overseas.
Doesn't say. I think that someone visiting, basically, I think they're asking if they would be able to use the marketplace to get care while they're here.
No. So if someone is not a U.S. citizen or a permanent resident, if they're not legally allowed to stay here in the U.S., they're not eligible for a plan on the marketplace.
Okay. And then this is going to be the last question because we are approaching 2 o'clock. I think this is a comment from maybe another question, or it was earlier in your presentation, but I assume that the cost sharing option that requires silver level actually means silver or higher. Is that true? Am I giving you enough information to answer that?
So, so is it only silver or platinum?
Yes. Or silver, gold,
Um,
or platinum, I guess.
No, I think it's only silver. It's
Okay.
only silver, but I will double check that to be sure, and I will follow up on that.
Okay.
on that particular
Thank
question.
you. So that is all the time we have for questions today. Jermaine, I want to thank you for the information that you have shared. This topic is very important to families dealing with PKD, and we greatly appreciate you for sharing your expertise with us today. George, I want to thank you for sharing, joining us, and for assisting the PKD Foundation in bringing this information to our audience. Also, I want to thank our audience for participating in this webinar, and we do want you to know that Jermaine has agreed to look over any questions that we were not able to address today, and we will post a question and answer document on our website along with the recording of today's broadcast.
And Nicole, if I can just say, like earlier in the Q&A session, I was looking for some notes and my computer wasn't cooperating, so we sort of lost some time there. So, you know, again, I reiterate the point that you just made. If you know, listeners have any additional questions that we weren't able to get to, you know, please feel free to submit those to Nicole, and I will follow up on those.
Okay, perfect. Thank you so much. The PKD Foundation appreciates the opportunity to provide our audience with the best possible education. We will be sending out a quick survey to everyone that registered for this presentation by email, and we appreciate your feedback, and we'll use your responses as we develop additional resources and programs in the future. And when you do complete the survey, please include additional topics that you would like for us to address in future webinars. To Jermaine's point there just a second ago, if you do need to reach out to us directly, you can email us at education@pkdcure.org, and a member of our team will get back to you, and we can forward your questions on to Jermaine as well. Again, thanks to everyone for participating today, and enjoy the rest of your afternoon.